Come in.
Hi, my name's Abigail. I'll be your student nurse today, and today we're going to be doing a respiratory assessment. Is that okay?
Uh-huh.
Okay, first off, I'm going to start with a couple history questions. So, do you smoke?
No.
Have you ever smoked in the past?
No.
Do you have any lung diseases such as COPD, emphysema, asthma,
No.
bronchitis, nothing like that?
No.
Do you ever have any chest pains?
No.
Okay. And do you get out of breath easily?
No.
Just by normal walking?
No.
Okay, I don't think so. Okay, so first we're going to start with inspection. So, move your hands for me. So I'm just looking at the chest right now. I'm looking at the color of her skin, looking at her extremities for cyanosis, which is blue, which would indicate not enough oxygen getting to her extremities and just her skin in general. Looking for pallor, which is paleness. Also just looking at her, look at me, buddy. Just looking at her breathing in general, and 12 to 20 is the normal breathing for a human for a minute. And then her respiratory rhythms as well, just that they're normal. I'm also just look at the back too for symmetry. Just make sure everything's good and she's not using accessory muscles to breathe. Stop, breathe right. She's not using any accessory muscles to breathe, and just everything's good. Next, I'm gonna go with palpation. So I'm just gonna palpate. Let me know if there's any tenderness. Does anything hurt?
No.
No? Okay. So when you're palpating, you're looking for tenderness, you're feeling for any masses, looking for bruising, just looking for anything out of the ordinary. And now we're going to do something that's called a chest expansion. So, or chest excursion, this is in the front. So right below the rib cage, you want to just put your fingers like that and breathe. Breathe. Take a deep breath for me. And you want to make sure that your thumbs, when she breathes, that they move out evenly. And then turn around. No, turn around. And then, no, sit up. And then this is chest expansion. So you want to go to T9, T10 and have her take a deep breath as pinching a little skin. Take a deep breath. And your thumbs should move apart evenly, 5 to 10 centimeters, which they did, which is good. Okay, turn back around. Okay, next is percussion. So you want to percuss over the lung fields. And you should hear resonance, which is normal sound. So, and then in the back, you should hear dullness or flat on the scapula, and then everything else will be resonance. Okay. So that was percussion. Okay, now we're doing auscultation. So now I'm just listening as she takes a deep breath in and out. I'm listening for any adventitious sounds such as wheezing, crackling, rhonchi. They would suggest that there's something wrong with the lungs. And you do this, start at the apex of the lung, which is right near the clavicle. So take a deep breath. Okay, sounds good. Then you also want to listen laterally. So you're going to listen in lift your arm up. You're going to listen in 3 different spots. On the right side, top, bottom, and towards the back a little bit for 3 lobes. And then on the left side, just 1 and 2, because that's how many lobes are on each side of the lungs. So lift your arm up. Deep breath. And other side, just twice. Okay, and You're an aggressive breather. Okay, and now we're going to do a couple tests. So the first one is the egophony test. Egophony, I'm not sure how to say it. I need you to say E every time I put the stethoscope on you, okay? And this, you should not hear E very distinctly, and if you do, it could be fibrosis or like stuff in the lungs. Can you say E? Good. Okay, the next one is the bronchophony test, so I need you to say, no, not 1, 2, 3. 99. You need to say 99. This is also listening for the same things.
99.
99? Oops. Okay.
99.
Okay, and then next is the whisper test, and she needs to whisper 1, 2, 3. And you should not hear this at all, if any. And if you do hear this good, it could be a mass or bronchitis. Okay, you need to whisper, bud.
Okay.
No, 1, 2, 3. Okay, I did not hear any of those. So that's good. And that's the end of respiratory assessment.
Abby, this